I got that word right. Yay. Okay, we are going to be looking at something pretty important, and that is provincial gaps persist in access to private healthcare cover. And the emphasis here being on the word private healthcare cover, not government healthcare. So this truly is very, very concerning. We understand that for millions of households, navigating medical costs is a very delicate balancing act, one that reveals who can access quality care, who must sacrifice to afford it, and who is left to depend entirely on public services. A very good morning to you, Risenga Maluleke. Welcome to the program to discuss something that is quite disturbing to all of us. Welcome.
Morning, Julie, and let me greet everyone out there.
Thank you so much. Should we be concerned about this particular situation, the gaps that is persisting in our private healthcare cover? When we talk about private healthcare, we do know that people who are in a private healthcare scheme do pay top premium. Most people do. And some of those premiums are pretty high. Why then do we still have these gaps that are glaring at us? What is happening here? And how does that talk to this new introduction? Well, it might not be that new, but over the past 10 years, maybe, we've been told, despite the fact that you are a private healthcare member, you should additionally to that take out gap cover, which comes at an extra cost. And for a lot of us, for many of us, it's not affordable. So what are your stats actually telling us about the situation?
Julie, let us start off by talking about the role of Statistics South Africa, which is to impartially, without taking any sides, making numbers available to policymakers, be it government, parliamentarians, as well as to captains of industry and members of the public, to be able to engage as and when they look at the situation. So, and of course, I listened to your opening remarks that indicated that we are not going to talk much about the public sector. And indeed, let us start also by saying that when members of the public do feel ill or they are sick, the first port of call that they go to are public facilities in the form of about 73%, 73.3% to be exact, and another 24% goes to the private sector. And of course, we need to go back a bit and say, why so? Is because members of the public do indicate that they generally feel that their own health is as good or as good to excellent from time to time. More in the colored population community, where we had the highest, sitting at 37%, generally not looking at the population group, males feeling more than females at 27.7 and 27.3 being females. The ones that felt that generally their health is not as good were the Indian Asian population group, at lowest, sitting at about 19%. So those kinds of things do play a role in terms of people determining whether they want to have medical aid cover or not. But they are not the only ones. There's an issue of income that comes on the side. So if you look at our population, out of about 63 million people that we have in our country, about 81% are Black African. And then we are followed by the colored population group at about 8% and at about 7.6% being the white population group and 2.7% sitting at, being Indian Asian population group. Now, income which we derived from the income and expenditure survey does indicate that in terms of what households have as income, it's highest amongst the whites, followed by the Indian Asian population group, followed by the colored population group, and the Black African population group is lowest. So let's give the numbers there. The income for the white population group is more than 647,000 at household, 1,000 rands at household level, whereas that of the Black African population group is sitting at about 128,000 rands. So that discrepancy does indicate that many people would ordinarily not be able to afford medical care in the form of private medical schemes because of their income, particularly in the Black African population group where their income is the lowest, as well as in the colored population group who are the ones that follow the Black Africans having the lowest income in our country.
Okay, Risenga, let's go for an ad break. When we come back, I want to break that down further. And of course, you are, being very impartial here, and you're talking purely from the data that was gathered on during the survey that Stats South Africa has conducted. So yes, of course, you will be very impartial regarding the matter. But I guess the all-important question then we should be asking as the South African population is, does this then mean we need to push for the NHI? Because the majority of South Africans fall below the income group where they're able to afford private healthcare. And I do know that might not necessarily be in your ambit of expertise. However, just as a citizen, just to apply your mind to those type of questions. But let's take that ad break at exactly 8:15. We'll come back and continue this very important discussion.
It's a wonder how kids get anything done these days. With all the distractions, when do they even get time to study? As a mother, all I can really do is make sure they have all they need to perform at their best. That's why I choose to include Sunfoil triple refined pure sunflower oil with every meal I make. Naturally cholesterol-free and approved by the Heart and Stroke Foundation as part of a balanced eating plan. So whether I'm cooking, frying or baking, I know every dish will be a wholesome one. Sunfoil, now we're cooking.
More than 800 million people around the world live in deep poverty, uncertain of where the next meal will come from. For those on the brink of starvation, a food pact means survival, dignity, and hope. Send food, send kindness. Be the reason a family does not go hungry. Donate now to Islamic Relief.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042 203 1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
Are you banking with convenience, transparency, and flexibility? With Al Baraka Bank's transactional banking account, you can enjoy convenient everyday banking designed around your needs. Benefit from zero fees on point-of-sale transactions and manage your banking easily through Al Baraka's secure mobile banking app and internet banking platform. From everyday payments to managing your personal or business banking, Al Baraka makes banking simple, transparent, and convenient. Visit albaraka.co.za to learn more. Al Baraka, your partner bank. Al Baraka Bank Limited is an authorized financial services and credit provider.
Africa. Give the gift of clean water with Africa Muslims Agency. With every water well or borehole you donate, your drop becomes a river, reconnecting communities to nourishment, education, dignity and empowerment. Sponsor a water well for 17,000 Rand in Africa or a borehole for 65,000 Rand in Afghanistan or Africa. Quench the thirst. Reconnect the soul with Africa Muslims Agency.
Rejuvenating media day by day. This is Salam Media.
Welcome back. It is 18 after 8 o'clock. We are talking a very important matter here with Risenga Maluleke, South African Statistician General, and we're talking about medical cover, access to medical cover. Welcome back, Risenga. Your thoughts on the question I left you with during the ad break or just before the ad break?
In terms of whether, Julie, one would think that people should, as a country, we should go the NHI route. It is not my space, and I can't give my own personal views on that because I'm always appearing as Statistician General, and so my views would not matter here. But let us look at what the numbers are telling us. The highest we have had in terms of medical aid cover nationally was around 2012, 2013, where those that were in medical insurance were sitting at about 18%. And that came from a low as far as 16% from about 2002. However, where we are sitting now, we are sitting at about 15% in terms of those that are having medical cover. And that represents about 9.96 million people as of 2025. And coming from way back in 2002, where we're sitting at 17.28%. One of the things we must understand is that obviously the population has increased from 2002. Having said that, the highest coverage of medical aid is in the Western Cape, sitting at 25.5%, followed by Gauteng, followed by the Northern Cape. These are the three provinces that are higher than national average of about 15%. The lowest are in Limpopo, sitting at 8.2%, followed by KwaZulu-Natal at about 9%, and of course the Eastern Cape. And when you look in terms of the income and expenditures survey that we conducted, the Western Cape had the highest household income, followed by Gauteng. And the Northern Cape, of course, comes third after them, not on the income side, but in terms of medical aid coverage. It is because the population of the Northern Cape is relatively small. So the wide population group that is in the Northern Cape does make a swing for it to come third in terms of medical aid coverage. Now, and of course, when you look at provinces like the Eastern Cape and Limpopo, they have the lowest what is that average household income nationally. And of course, it would be no surprise that we see that the coverage in those provinces, Eastern Cape, KwaZulu-Natal, and Limpopo, remains lowest. It's largely because when people want to make a decision whether with the income they have, they should deploy it to insurance in general, before we talk about medical aid coverage, insurance in general, and whether they should deploy it elsewhere, they would rather deploy it to choose between food and and some non-essential or some bit of essential services they need. Then that contributes. So income plays a big role in our country. But having said that, I will leave the space of whether we should have an NHI to policymakers, because that space is not reserved for me as Statistician General.
Okay, I take your point. We're going to wrap up, but let me ask you this important question. When we look at the demographic and regional breakdown, we do, as you've indicated, white households obviously does contribute the highest to medical aid at approximately 48.1, not million, but billion rands. And then, of course, we see the contrast with the Black population, which obviously are the majority of the country. And I'm kind of wondering, with those type of figures, Gauteng, for example, contributed 36.1 billion rands. And those are absolutely staggering figures for a small amount of people that have private health care. What does that say to us as a country, and what is this message saying to policymakers and government? What needs to change? What needs to change to create a more equitable balance amongst the different racial groups in our country regarding medical aid cover, private medical aid cover, and access to medical health?
For starters, let us say that the figures that we are raising, the figures that you have spoken in terms of the billions, are not new. They've been part of us before the dawn of democracy, and they continue to be part of us now. The second issue that follows with that is an issue of they do take a population group narrative where the color of your skin does stand in as to whether you will have medical aid or private medical aid coverage. And indeed, the policymakers are not those in government alone. Policymakers are in government, in parliament, in our legislatures. And of course, we have captains of industry in business, as well as members of the public. So this story of who is covered the most and who is less covered in terms of population group should captivate all of us as a nation. Now, the only way I can summarize it is that our nation needs to transform, because this matter, it's not seen only in medical aid coverage. It is seen in all other aspects of life, where the white population group is far ahead in terms of being well off, average household income being the highest, followed by other aspects of life. And then the Indian Asian population group are catching up with the whites. At the bottom are the colored population group and the Black Africans. And not only that, you look at other challenges in terms of proportions of those who have completed post-matric. It shows a similar pattern. And indeed, when you look at social ills that are emerging in our society, be it substance abuse and other issues, especially amongst the youth, more amongst the colored population group and the Black Africans. And it's not because they are in the majority. It's because our society hasn't transformed sufficiently enough.
And that's where we leave it. Worrying indeed is what I would say. It's truly cause for concern. And as I've said just now, that we do hope and pray that policy makers, both in government and captains of industry, apply their minds to this matter and, forge ahead with a plan to cover the majority of our population regarding access to medical aid and medical aid insurance. That's where we leave it. Risenga Maluleke, thank you indeed for joining us this morning. You are South African Statistician General. God bless and go well.
Many thanks indeed, Julie.
It is exactly 8:28 a.m. this Monday morning. Let's go for a break once again. And when we come back, lots more to cover on News and Views right here on Salam Media.